We all know COVID-19 is a massive health concern. It has played a role in the deaths of nearly 11,900 Hoosiers. But the pandemic is also taking a toll on the mental health of so many people. And that includes the people who put their health on the line every day to make sure you are taken care of in one way or another. We're talking about frontline workers. At about 1 year into this pandemic, Alyssa Donovan checks in on those who make it their work to check in on you.
I remember when it first started, I was really hesitant about even taking on patients with COVID.
But nearly a year into the pandemic, nurse Kevin Kamima has helped dozens of patients recover from COVID-19 at St. Francis Hospital. He's also lost so many.
It was kind of tough to see the patients. They have to pass alone. You don't wish that on anybody.
Respiratory therapist Scott Hughes says seeing people pass away without family nearby continues to take a toll on hospital staff.
That's been hard on everybody.
Hughes taking advantage of the counselors through Franciscan Health's Employee Assistance Program.
At some point or to some degree, mental health is going to be a concern for everybody that's, been here through this.
During the second surge around the holidays, St. Francis Hospital was up to 120 COVID-19 inpatients a day. Over the last few weeks, that number has come down to about 30 a day. But even with declining numbers and a better understanding of the virus,
we're now able to attack the virus in a more efficient way.
Frontline workers are still faced with challenging decisions daily, like whether or not to put a patient on a ventilator.
At that point, you only have really one choice, and that's to keep them breathing. And it's been hard for us to know that those patients sometimes just aren't going to make it later, but we don't have a choice but to try and help them now. I know that part has weighed on quite a few coworkers pretty heavily throughout.
The uncertainty and the losses have been hard, but frontline workers are seeking out resources and leaning on each other when the fight has gotten too tough.
I think that's one of the most beautiful things I've seen from all this. When you come in to do report in the morning or at night or, shift change, you will a lot of times see, anywhere from 4 to 6 different cultures communicating for the same goal, to make sure that the patients are taken care of and to make sure that each other are taken care of and that we all get home.
I'm Alyssa Donovan, WRTV.
Both healthcare workers we spoke with today say they know the pandemic has dragged on, but wearing masks needs to continue. Hughes stating that it's proven in other countries that masks work and that it will help slow the spread if we just continue to abide by that rule.